Hello, I'm Sophie Hurewitz, a current undergraduate student at Duke University. I'm presenting today on behalf of our research team, a collaborative investigating strategies to improve childhood food insecurity. Here in our background column, you can see that our research team is working to inform implementation of the North Carolina Early Childhood Action Plan, a statewide initiative aiming to have young children healthy, safe and nurtured, and learning and ready to succeed statewide. We are focused specifically on Goal 3, to ensure that children and their families across North Carolina are food secure. Food insecurity impacts a child's well-being, yet it is often not addressed in traditional healthcare models. The North Carolina Integrated Care for Kids model, or INC, is a child-focused service delivery and payment model aiming to integrate cross-sector services, including food resources, to improve the health of more than 80,000 children in the state. INC aims to better coordinate care for children birth through age 20 that are insured by Medicaid or CHIP in 5 North Carolina counties. Ultimately, our recommendations will provide a roadmap for North Carolina INC to pilot strategies to best identify and address childhood food insecurity. In our middle data and methods column, you can see that we conducted 34 semi-structured informant interviews to gather more information about food insecurity across the state. We recruited informants from programs in various sectors, including community, school, religion, and government. During our interviews, we asked about COVID-19 adaptations, family engagement strategies, sustainability, barriers, and hypothetical solutions. We then used rapid qualitative analysis and a matrix to inform our findings for North Carolina INC. Because the pandemic changed so many food resource programs, we've divided our findings into those specific to COVID-19 and those that are more general. First, our leftmost graphic shows how the pandemic has dramatically increased the need for food assistance programs. Additionally, because schools closed, our second graphic shows that public school districts implemented daily and weekend meal pickups and created new pickup schedules. Our third graphic in this row highlights how COVID-19 brought about a heightened awareness of food insecurity and increased generosity in the community. However, despite being able to adapt quickly to the pandemic, our fourth graphic emphasizes how informants revealed that programs worry that they may not be able to maintain these adaptations in the future, especially if community support dwindles. Moving to our far right column, we identified 5 main general findings. The common barrier of transportation and limited access to available assistance programs, the presence of stigma that discourages program utilization, numerous other access barriers related to enrollment and internet access, and an overall under-enrollment in available federal programs. Below these graphics, you can see that we highlight several particularly important quotes that describe each of these findings. Our recommendations for INC are targeted at both the community and systemic level. Our community-based recommendations fall into 4 main categories: to educate, identify, outreach, and connect. Community-based recommendations include hiring care coordinators to discuss food insecurity, encouraging utilization of NC Care 360, identifying food insecure children, increasing enrollment in federal programs, hosting community listening sessions, and connecting families to resources. Our system-level recommendations include extending COVID waivers to increase access to food assistance programs, providing universal school meals, increasing access to modes of transportation, and continuing to advocate for food sovereignty and autonomy. Thank you so much for listening today.